Let's talk about Neer classification of proximal humerus fractures. Neer classification is based on number of displaced parts of the proximal humerus. The proximal humerus has 4 parts: greater tuberosity, lesser tuberosity, humeral head or articular segment, and shaft. A part is considered separate only if it has 1 centimeter of displacement or there's a 45 degrees angulation. If not displaced, then it is not counted as a separate part. Now let's talk about the classification. 1-part fracture. In this type, no part is significantly displaced. It is most common type, usually treated conservatively. Even if there are multiple fracture lines, if no displacement, then still it is 1 part. 2-part fracture. In this type, 1 fragment is displaced. Common examples are surgical neck fracture, greater tuberosity displaced. 1 part moves, others stay in place. 3-part fracture. In this type, 2 fragments are displaced. Usually, surgical neck plus 1 tuberosity displaced. It is more unstable. 4-part fracture. In this type, all 3 fragments are displaced from the head. Head loses blood supply easily. There is a high risk of avascular necrosis. Hope you have understood the concept. God bless you all. See you in next video.